The broadcast is now starting. All attendees are in listen-only mode.
Hello, everybody. My name is Andrew Capehart with the APS Technical Assistance Resource Center, or APS Tarc. Welcome to today's webinar. The title of our webinar is Spending Your Funds Wisely on Services, Opportunities, Challenges, and Experiences, and we'll introduce our speakers shortly. Next slide. A quick disclaimer before we get started. The Neighbors Project and the APS Tarc project are projects of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, administered by WRMA Incorporated. Contractors and our speakers' findings, conclusions, and points of view do not necessarily represent those of the federal government. Next slide. A little bit about our APS Tarc. If you're not familiar with us, we're here to help your APS program any way that we possibly can. Just reach out to us. We'll have contact information displayed at the end of the webinar, and this call to come to us if you need help is especially relevant for the formula grants. We have special assistance we can provide to formula grantees, so please keep that in mind and let us know if you have any questions at all, need any help. We work to enhance the effectiveness of APS programs by working with partners on use of data and analytics, applying research and evaluation to practice, and encouraging the use of innovative practices and strategies. Next slide. Please consider joining one of our peer-to-peer calls if you never have before. We have 3 calls per month, one for APS workers, one for supervisors, one for administrators. The schedule is also on our website. The administrators call would be especially helpful for many of the people on the call today. And you can bring up any issues that you have with your formula grants and talk to other administrators that are on the line. So again, if you want to attend any of these, just reach out to us. We'll put you on our email list or go to our website and you can sign up there as well. Next slide. I will go over a little housekeeping before we get started. Today's slides are available to download in the handouts section of your GoToWebinar control panel. Just click on the title of the slides and you can download those in PDF format. All the participants are muted for the duration of this webinar. You can use your computer or your telephone to access audio, whichever you prefer. Just adjust the volume to your desired level. And if you're having any problems with the audio or seeing the slides, we strongly suggest you just exit the webinar and then come right back in. That actually fixes many things, just like when you have to reboot your computer. Xing out of the webinar, leaving, and then coming right back will often fix many of those problems. Next slide. If you have any questions of our presenters, just type them in the questions box, and you can do that anytime you like. You don't have to wait till we pause for questions. Those will just accumulate, and we'll get to those whenever we do pause to take questions. This session is being recorded. All the registrants will be notified at a later date when it's posted online. We'll do that via email. You'll also receive an automatically generated email within 24 hours after the webinar, and it'll include a link to a certificate of attendance. It will also have a quick, brief survey, 4 questions total. We would greatly appreciate it if you would answer that small survey for us. Next slide. Thanks for all of our speakers joining us today. I think I'm going to turn things over to my colleague, Carl Urban, now to take it from here. Oh, Carl, you're on mute, by the way, if you started talking.
Andy's constantly reminding me, go on mute. Not talking.
It's true, I am.
And it never fails. So hi, my name is Carl Urban. I'm Senior Research Manager here at WRMA with the Adult Protective Services Technical Assistance Resource Center. I will be your facilitator today, and we have a couple of panelists with us. And I am going to let them provide a brief introduction of themselves instead of the standard read you the bio. So, Victoria, would you mind introducing yourself?
Of course. Hello, everyone. My name is Victoria Golick-Morse, and I serve as the APS Project Administrator at the Department of Social and Health Services Adult Protective Services Program here in Washington State. I report directly to our APS Program Director, Kathy Morgan, and my role really is to manage our grants as well as supervising a team of outreach and engagement specialists. I'm really happy to be here today to talk a little bit about Washington's experience with this wonderful funding opportunity.
And Mary.
Good afternoon. I'm Mary McGurran. I work for the Minnesota Department of Human Services. Minnesota is a state supervised county administered adult protection program. So our role at DHS is to provide support for our county partners who are administering the adult protection program. And to do that, we have a 7-person team that I am leading. We have a contract administrator for the Minnesota Adult Abuse Reporting Center for our centralized reporting and an operations manager for the reporting center. We have 2 adult protection resource specialists to provide consultation and support to our county partners. We have a program consultant, and we have a trainer and a data analyst. And we are located in Aging and Adult Services, and I report to Carrie Benson, who's the Director of Aging and Adult Services at DHS.
All right, thank you much for those introductions. Want to talk a little bit about what we are going to do today. So we at the APS Tarc are doing a series of TA things related to supporting state APS programs for the formula grant funding. And this webinar is one of a number of different things that we're doing. I think you can expect a couple of other webinars and some other products coming from us as well. We took a look at your spending plans a while back, and it was very clear that one of the themes in them, one of the commonalities in them across the states was that you guys were going to be spending money on services. And then we even held a listening session a while back to just talk about the issue of spending money on services, trying to get a sense of what your needs were. And this webinar basically came out of the feedback that we got from that. We spent some time looking at the notes and the discussion from it. And it seemed like there were 3 things that you were kind of interested in. What are the requirements related to services? What are states actually doing with the money related to services? And then, wow, I'd like to hear from other states and understand and learn from their experience. And so that's basically the 3 objectives that you see here today. So let me tell you about how this is going to work. So that's what we're going to focus on. Let me tell you about how it's going to work. So basically, we're going to do 2 things today. We're going to have kind of an introductory session where we're going to give you some background. We're going to answer basically those first 2 questions that you see there at a very high level. And we're also going to have a few poll questions in there for you so that you're able to give us some feedback on kind of where you are related to services. And so that's the first section of the day. The second section of the day is we're going to get into our panelist discussion. And we've got a series of questions for the panelists that we want them to discuss. But before we ask the panelists the questions, we're basically going to ask you the questions. So we've designed this to be a very interactive day to where we're giving you the opportunities to ask us questions and give us feedback as we're going along. And hopefully we've created some sort of communal dialogue sort of thing here today to help us get to a place. So as Andy said earlier, use that question box to ask us questions as we go along. We will pause during our panelist discussion multiple times to look at the feedback and to read the questions that you may have sent us. All right, so let's hop first into that background section that we talked about. And here is the first of a number of poll questions for you guys today. So the poll question is, which of the following issues related to purchasing services do you have concerns about? Check all that apply. Andy, my man.
I will launch that. I will launch that for us right now. It's up on your screen. If you're in full screen mode, you might have to exit out of full screen mode to actually vote, and you vote by clicking directly on your screen. You may select more than one answer for this poll. So again, exit full screen mode if you're in it, and click directly on your screen by voting. More than one answer if you like. I'll leave this up for about 10 more seconds and give everyone a chance to vote. Maybe another 10 seconds just because people are still thinking, I think, about it a little bit. So
I'm always amused during these webinars how Andy tries to think of something to talk about while the poll is going on.
Well, at least I don't sing Jeopardy music or anything like that. So I'm going to close that poll out now and share the results with everybody. You can see the results here on your screen. 71% meeting federal requirements, 62% managing spending, 33% providing services least restrictive environment, 52% matching client needs and services, and 29% addressing equity or underserved populations. So I will take those poll results down and I'll go right back to the slides.
So Victoria and Mary, you might, to some extent, I know you've already worked on your responses, manage to those particular requirements or those particular interests as we go along. So here is a second poll question. I promised you lots of polls today. So the second poll question is, which of the following best describes your use of the formula funds for services? This is the first time funds for purchase of services. In other words, you're an APS program that's just never had funds for services before. The second category is this is going to significantly augment your budget for services. You got some money. This is a huge bump. Third category is it's going to moderately bump up your budget for services. And the fourth category is it's going to be a minimal addition to your budget for services.
And votes are starting to roll in. I think people are thinking about this a little bit. This is one where you just select one answer as opposed to multiple answers. I'll leave this open for another 15 seconds or so. And again, you vote by just clicking directly on your screen. All right, I'm going to close that poll out right now and then share the results with everybody. 38% first time funds for purchases of services. That's the majority. 23% significantly augment budget for services. 29% moderately augment, and then 10% minimally augment their budget for services.
So 38 and 23, I'm not real good at math. That's why I do namers. That's well over 50% of you. This is a really significant addition to what you are able to do with services, which would indicate that this webinar is well targeted in terms of our content and some of the things that we want to talk about. Now I want to give just an ever so brief overview of the spending plans, just to kind of give you some context of what you guys are going to be spending the money on. There was a wide variety of specific services outlined in those spending plans, and those services, which we'll talk about on the next slide, are really targeted to the cause of the maltreatment of your victims. And the two things that we kind of saw specifically in there was a lot of focus on social isolation, and then, as you would expect with formula grants related to COVID, there was a lot of targeting for needs directly caused by COVID. There was not in the plans a lot of discussion about the procurement methods, and I don't know that we're going to have a lot of discussion about procurement today. But a couple of different methods that were mentioned were use of pools of funds for purchasing at the local level. Another method that was mentioned multiple times was using credit cards for staff. So what are you spending the money on? Lots of money for supportive services. And I guess this is probably not surprising in the world of APS: meals, in-home cleaning, transportation, etc. I didn't even try to make an exhaustive list here. I think you get the idea of what supportive services are. And then the other thing that we've noticed with the new formula grant funding is there is a lot of focus on emergency housing. I think APS programs have long recognized this as a need. Now we have an opportunity to be able to address it with these funds. And then the last point I would make is there was some focus on use of telemedicine and some other ways of trying to be able to communicate with clients, to be able to help clients translate into that world of getting services. And so there's some innovative things that we're going to be doing with that as well. So overview of guidance related to services. And let me just start off this by saying, don't ask me any questions about ACL guidance. Those are questions that only ACL can answer, but I did think it was helpful for purposes of this to kind of frame what we're going to be talking about with the guidance that they have given so far. So I'm just going to literally repeat what they have told us so far. So the first thing is the program reporting guidance document that they have given us. And there are two key points in it. You've got to do your programmatic reporting. And so what they suggest you consider using the APS logic model for that. Within that APS logic model, there is a section on post-investigation services. So one of the frameworks that you want to think about using for your programmatic reporting is this construct or this idea of post-investigation services. And even don't get hung up on that word post, I guess is what I would say to you. It's to think about the framework of reporting specifically on the investigation services that you provided with the funding. The other thing that the guidance document does is it provides you in Appendix 3 the common home and community-based services definitions and units. And so that is a list that's there for reference for you to use in talking about your services. So everybody's using kind of the same language and the same set of services. Then there's some FAQs. And in the FAQs, there's some questions in which they define what allowable uses are. And there's one specifically that talks about services for clients, and it says these funds may be used to pay costs for and associated with providing goods and services to APS clients impacted by COVID-19, including home care. So that's some very direct guidance on how the funding can be used for services. And then there are some examples in some subsequent questions. And you see that they are for cost for and associated with providing goods and services to APS clients, cost for and associated with assisting APS clients to secure a least restrictive option for emergency or alternative housing, and with obtaining, providing, or coordinating care transitions as appropriate. And then finally, cost for and associated with COVID-related cleanup sanitation services for an adult to return safely from their home environment. I would just emphasize these are examples, and always direct your specific questions to your program officer at ACL. So that concludes kind of the first part of our webinar. We're going to transition to that second part of the webinar with our panel discussion. And here's how that's going to work. We have 4 constructs that we want to think about. How do I think about services to APS clients? And those 4 constructs are policy and practice, performance metrics, personnel, and partnerships. And so we're going to spend some time talking through each of these areas. And the way we're going to talk through each of these areas is we're going to start with a poll again. We're going to find out your status and ask you a discussion question in each of these areas. And so while you're having an opportunity to respond to the discussion question, I'm going to have a discussion about those 2 questions with our panelists at the end of each of these sections, at the end of each of these constructs. We're going to pause to see if you've got any Q&A with our panelists. So we're going to have a series of discussions here on each of these areas. So I thought for just a context sake, it would be helpful to share with you guys some of the services that Minnesota and Washington currently provide. And so you can see the long list of services here. And as we transition into our panel, one thing I want to reemphasize that they said before is we were quite intentional in selecting our 2 states based on a couple of different things. One, when we had that listening session before, Victoria and Mary both had a lot of good comments, and so we thought they would be good resources for us. But the other idea that we had in mind that we wanted to be sure to cover is this question is different for a state-administered, for a state overseeing county-administered program like Minnesota versus a state-run program from Washington. So with our panelists, we were definitely wanting to get both of those perspectives. So here we go. Policy and practice. Here's the audience input part of this. So our poll question is, do you have written policy and practice guidelines for purchase of client services? Yes or no?
We'll launch that now. And Carl, we had a question a little bit earlier that involved defining purchase of client services. Is there anything more you'd like to say about how you define that?
Sure. While you guys are doing that poll, when I talk about purchase of services, I am talking about funding that the APS client, that the APS program has to use to ameliorate the effects of or eliminate the maltreatment that the client or victim is suffering. So it's not, I've got a client, make a referral to the area agency on aging. It's, I've got money and I'm going to go do a deep house cleaning for this particular hoarder, and I have APS money that I'm going to spend to do that.
Thank you, sir. I think we're going to go ahead and close that poll out right now. Most folks have voted, and the results are 60-40. 60% said yes, 40% said no.
So that's interesting. So this is clearly an area of need for you guys. And so while our panelists are talking, we do have a discussion question that you can use the question box to answer, and that is to describe any new policy or practice guidelines that you had to develop in response to the formula grant funding. So if you had or didn't have, so if you had policies and procedures, what did you have to do that was new in response to the formula grant funding? Or if you're having to develop them for the first time, what are some of the things that you are having to do? Provide a description of them. And those two questions are more or less our first questions for our panel. We did not draw straws or anything, so Victoria, maybe you could go first, and if you could talk a little bit about how you provide policy and practice guidance for purchase of client services.
Yeah, certainly I can go first. So as Carl mentioned earlier, Washington is a state-run program. And to kind of give you guys a little bit more context, we have just north of 600 staff who work for our APS program with over 400 investigators. And Washington State is broken up into 3 separate regions. And so prior to this COVID response and relief funding, we did have access to a limited pot of money, and that money could be used to purchase services or to have things done for our alleged victims. And so we called those intervention services. And, you know, as you were able to see on the previous slide, you know, those are the intervention services that we had active contracts for. So those were things like cleanouts and in-town moving services, and, you know, a few other things, again, that were listed on the previous slide. You know, ultimately, I think Washington State, we are an investigative agency. So our goal is to, you know, go into a situation, investigate the allegation or allegations that we're seeing for alleged victims. And then while we're there, while we're making that connection with the alleged victim, providing some sort of protective service. And usually that means, you know, referring them to community resources or partner agencies within the Department of Social and Health Services to ensure that, you know, we're meeting the need that we're identifying with that alleged victim. But ultimately, our interaction with an alleged victim in general, I would say, is on the shorter time scale. The majority of our cases, you know, we have regulations about our cases being closed within 90 days unless we have a good cause reason to keep, you know, a case open. And I won't go into all of those details, but so all of that to say, we had policy beforehand about purchasing these client services or goods for the alleged victim. But because of this new funding source that we received for the COVID spending, we kind of took a look at that policy, and we saw that we needed to develop something more substantial because, you know, we knew that we were going to have all this extra money running around, and we wanted to be able to kind of expand the scope of the things that we were able to purchase for our alleged victims. And so myself and our legislative policy and legislative program manager drafted up a new policy. We call them MBs in our neck of the woods here, where we provided some additional guidance to staff on, things like what can and can't be purchased, the process for getting approval to make purchases, the staff that have to be involved in this purchasing process, who to contact, and then also how we're tracking where this money is going and who this money is going to. We'll get a chance to talk a little bit in more detail about this, but we did develop a new policy for this funding, and we did a lot of staff training around this policy that are directly related to how we're going to spend these COVID funds.
All right, that is great. And so I would like to just take a second before Mary talks to encourage the rest of you to go back and respond to our discussion question. Let us know how you had to develop any policy or practice guidelines in response to formula grant funding. We've got one description of that from you. We would appreciate any others that you could put into the question box. And also be thinking about and or putting in any questions that you have for our panelists as they are talking as well. Mary, how about you? How do you provide policy and practice guidance, and what did you have to do different in response to the formula grant funding?
Sure. Well, first of all, as a state supervised county administered state, Minnesota has policy guidance for counties. How they actually practice or administer their programs is the county's is part of the county's program administration. So we have policy guidance to help stop ongoing maltreatment and prevent reoccurrence and promote safety, healing, dignity, and justice for vulnerable adults who've been reported as abused, neglected, or financially exploited. And our policy is to offer services to reporters, even for screened out reports that don't meet the policy criteria or the county's prioritization for screening in. And our policy is to assess the safety, strengths, needs of the vulnerable adults and work with their primary support person, develop a safety plan, and that's after the first visit, and offer service interventions as part of that safety planning to the vulnerable adult and the primary support person, regardless of the investigative determinations. So our service policy is really quite primary in the role of adult protection. We also require adult protection to enter the service interventions that are offered and provided, making a distinction between the two for the vulnerable adult and their primary support person into our data system. So the policy is to require the collection of the data of those things. When we were looking at this opportunity under the Coronavirus Relief and Response Act, we looked at some of the data that we had as a result of our policy, and we found that our APS screening has been trending down as a percent of total reports for the past several years, and more so during COVID. We also received less reports during COVID, 8% fewer reports, although the number of reports of self-neglect slightly increased during the COVID period. And since the end of COVID now, we're seeing quite a rebound in our reports. The first half of this calendar year, they're up 7%, but in individual months since our state emergency has been slowly tapering down to its final end on July 1st, we had 25% increased reports for APS in April, 19% in May, 17% in June. Again, self-neglect being the highest allegation. We also looked at data related to maltreatment screening by race to look at equity, and we found that people of color are screened out at a higher rate than vulnerable adults were reported as white. We also have data that in our state that coronavirus impacted communities unequally in our state. And we have a stakeholder engagement that we ended in 2020 that really showed us that our stakeholders in our adult protection system, as well as our work that included our county workers and supervisors, managers, as well as folks in the community, really wanted to see a service focus. So looking at all of those things and knowing that we already had a service focus, we also surveyed our county administrators and found that 71% of those really felt like spending this money on services was important. And so the bulk of our money in this funding stream is going to be going for services, and about a third of it is going to counties for competitive grants, and a third to our tribal nations for adult protective services for people that meet the criteria under our State Vulnerable Adult Act that the tribes are providing services for. So the policy isn't changing, but the focus and the resources are changing. When we look at our data system where we can collect services, I believe purchase services last year by adult protection were about $110,000 or $111,000. So this is a very large increase. And so without a lot of ability to tell the counties how they should administer it, we're going to be administering it through competitive grants, and that'll require, and the policy is really going to come out in the proposal requirements for those grants, how the grants are evaluated and scored, and then the contract terms and conditions for the grants. So that's really how we're managing the practice guidance for purchase of service under this. It's through the contract.
So in a county administered state, the counties probably have their own policy and practice guidelines. How much influence or say do you have over those directly or indirectly?
So we don't have any direct influence on how on their purchase guidelines, but what we do have is a system, data system for entering services. And then also we have what we call BRASS codes, budgeting, reporting, and accounting codes for social services that are classified for adult protection, for all of the adult programs and all the child programs, but adult protection has codes that would be entered under our programs. And we have allowed codes for adult protection for our current state grants. We have about $5 million in state grants that go out right now that the counties decide how to spend, and then the allocations are reported back through the BRASS codes.
Okay. So the way that I mentioned earlier, the way I want this to work is that we go through each of these topic areas and see what your feedback is. And so I have responses. So this is the time to be typing in any questions that you may have for Mary or Victoria. And I'm looking at the responses so far. So Colorado indicates that they have client service guidelines already in place, but they're going to have some very specific new guidelines for the EGA Round 1 funds. Kansas indicates they're developing some practice guidelines for their AAA contracts that they are working on. And that's the only two states that responded on what they are doing with their current policy and practice guidelines. We do have a question for Mary. And Mary, the question is, how will you monitor the county's expenditures for APS services? And while Mary's answering that, if y'all have any other questions in the area of policy and practice, please be typing those into the question box. Mary?
Sure. So that's going to be the requirements through the contract. So we'll have, it's a competitive contract. We are awarding contracts, multiple contracts, and they're different categories based on the size or the population of the county and their ruralness. And also because of the aforementioned inequities that we know exist in our system, we're encouraging counties to partner with community providers that are experienced in working with people from communities that are disparately impacted by COVID-19, that have experience in culturally sensitive practices, that have expertise in diversity. And the counties will be, through those partnerships, responding back to the request for proposal, providing the information about what they're planning to do, what their objectives are. They'll be selecting 2 to 5 measurable objectives. So that's how we'll be measuring that. We'll also be receiving the expenditure information in the budget for that, and then they sign the contract. So it's really through the contracting process, and we'll be using the same deliverable questions, or the same accountability questions that ACL is asking for the states. We'll be asking the counties, and those will be part of the contract.
All right. No other questions, so let's go on to performance metrics. And again, we'll start with the poll question, which is, do you have any performance metrics to monitor and manage purchase of client services? Yes, no. Andy.
I have launched that for us. Again, just like all the other questions, vote by clicking directly on your screen. Leave this open for another 30 seconds or so. And another 10 seconds, I'll leave it open. All right, I think I'm going to close that poll out now and then share the results with everybody. 24% said yes, 76% said no. Do not have performance metrics in place for client services.
So this seems like it'd be a good topic for our panelists. For you, 26%, did you say?
24.
While they're talking, feel free to list some of your key metrics in the question box for us all to see. And so then my panel discussion question, I actually have an additional question here that I didn't put on the prior slide, which is, what type of IT system do you use to track performance? So I think since Mary's been talking a lot, we will let Victoria go first again with these three questions.
No problem. So I think first it's important to mention that myself and the policy and legislative program manager that we have here, as well as the, I'll just say the two of us, we hosted a series of 4 webinars for all APS staff here in Washington State about the new policy that I mentioned earlier. And so staff were able to ask questions and get clarification, because in our policy, we did call out some specific performance metrics or some tracking metrics that were going to be important for us to ultimately report up on, how we spent this money and where this money was going. We did record the final version of that webinar, and we posted it on a SharePoint page that we had created specifically for this COVID-19 spending. And so this way it was really a way for us to communicate with everyone, all of our staff across the state, and at least have a centralized place where people could go to collect information about this COVID spending. And so to give a little bit more information, part of that policy that I mentioned earlier involved the creation of an authorization form, as well as this SharePoint tracking page that is embedded within the larger SharePoint page. And so some of the elements that we're tracking on both the authorization form and the SharePoint page include the age of the alleged victim, the investigation ID, the type of purchase, the amount of the purchase, staffing or discussions that went into the approval process for this decision, among a couple of other things. So those are kind of the big metrics that we're currently tracking. Myself, the policy and legislative program manager, again, as well as the APS office chief, we had set a monthly meeting with regional point people. And so, as I mentioned earlier, Washington State is broken into 3 separate regions. And these point people are the ones who are responsible for making payments on the purchases that staff within their region are making. And so we set up these monthly meetings just kind of for the beginning of this grant process getting started up, just so that we can check in with them and kind of get an overview of like broad spending patterns that they're seeing, issues that they may run into, and then also successes that they're seeing, because we want to make sure we're talking about successes that we're seeing as well here. Additionally, with another part of this funding, we hired 2 extra headquarters staff to assist with this tracking and evaluation of the data that we're going to get from this. We had a sense that folks were really going to be excited and enthused about having this dedicated funding source and kind of this expansion of capabilities to purchase things for alleged victims. And so we knew that we'd need some extra hands on deck to be able to support the tracking piece of this work. And so those folks just recently started, and we're already having conversations about additional metrics because they bring a wealth of knowledge and experience with the vulnerable adult population and getting programs started. So we're already having more conversations about additional metrics that we may be able to pull from our online system and from the data that we're already asking our investigators and supervisors to provide. And so the last thing that I'll say is we do use a web-based system. Our system is called TIVA 2, and that is where all of the information about our investigations is housed. At this point in time, we haven't used any of our development time to update our IT system to incorporate anything about this funding. I think for us, that process of going to our developers and requesting change, even though that they're internal folks that we have here, we're lucky enough to have that system be owned internally. That can just be a really long process, and especially since we don't know what the long-term picture looks like for this COVID-19 funding, we were kind of hesitant to make any large-scale changes to our IT system. So we have, I guess, kind of a couple low-tech ways that we're keeping track. But again, we just got new staff on board, and we're kind of looking at all different avenues here.
All right, Mary, Minnesota.
So we don't have performance metrics to monitor or manage the purchase of client services on a statewide basis. And I kind of struggled on how to actually think about that when we really do the individual assessment of each client and develop an individual service plan based on their strengths and needs and the safety assessment. So the performance metrics are not directly related to the services. We have performance metrics statewide that we use to help with our system on repeat maltreatment and the timeliness of response to vulnerable adults reported as maltreated is going to be actually a new metric, but again, it doesn't relate to the client services. Some of the key metrics that we look at are the brass codes entered for adult protective services, are allocated, I should say, to adult protective services under our system, and that helps to track what kinds of services are being provided to clients and the amount of the purchased services for the clients. But really a lot of the how the counties allocate their funds or spend their funds is really made on a county level, not at the state level.
Which I think would be, yes, I think it would be difficult to roll something like that up at the state level. No one typed into the question box any specific metrics that you use. At this point, does anybody have any questions about how the monitoring is done of the use of these funds for our panelists? If you would, type those into the question box, please.
And this is Mary. I guess I'd add that the activity or the requirements under the grant for how many people were served, how many people over age 60 were served, and the activities of conducted under the grant will be some of the metrics that are used to evaluate services.
Okay. I am not seeing any questions related to performance management, how you're managing the contracts. And we will have a chance for wrap up at the end. So I think we're going to move on. And if you have any questions on that, go ahead and type them in and we'll pick them back up at the end. So let's go on to personnel and staffing. And so our poll question for this section is, what type of personnel are authorized to purchase services? And this is a check all that apply.
And I have launched that for us. So just like Carl said, you can select more than one answer for this. You can select them all if you like. We'll leave this open for another 30 seconds or so. And this question pertains to the people who are actually authorized to purchase the services, to make the authorization for the paid services through APS.
And I would just encourage Mary and Victoria. We were probably running a little behind, so let's be as succinct as possible as we're answering the next couple of questions.
All right, I'm going to close this poll out right now and share the results. Looks like caseworkers come in second at 50%, supervisors 73%. Specialized purchasing staff 27, contract staff 2, and other 25%. So it looks like supervisors for most of the folks that responded.
That is interesting. So the discussion question is to describe the type of training that staff receive on purchase of services. So if you could be typing that in the question box, that would be great. And those are our questions for our panelists. And I think, Mary, we're going to let you go first this time.
So the training is really on the systems that we use, on the brass codes and on the social service information system. That's the type of training that's offered at the state level. And the counties have their own way to handle their fiscal work.
And so from a state perspective, which type of personnel is really a county decision?
It is totally a county decision. It'll be very interesting under the new grants with the encouragement to partner with local agencies, how the counties decide to handle that authority.
And Victoria.
So the way that we have it set up, or the way that we wrote our policy, is that APS investigators are the ones who are interfacing with the AVs, and so they're the ones who are identifying needs. Ultimately, our normal process involves regular case staffings with supervisors. So our process is the investigator identifies the need, raises it to the level of the supervisor, and the supervisor is the one who's signing off on that authorization form that I mentioned earlier. As far as training goes, the way that these purchases are set up to work right now, we have multiple credit cards that are kind of spread throughout each of our regions. And these credit cards live with an individual who is designated as a card custodian. And there is a agency standard training that staff need to go to become a card custodian. And then there is some additional training that staff need to do to be able to use the credit card. And so, basically just kind of depending on what level we have for this purchasing process, there's kind of different levels of training that are, standard and that we don't necessarily have control over. But ultimately, I'd say that the personnel who are authorized to make the purchases are certainly our investigators with the approval of their supervisors.
Okay. Are there any questions related to staffing, either the ones I thought of or any other questions that you may have related to staffing? Let's see, we have a question here. It's more comment than question. I don't know about anyone else, but I'm so overwhelmed with the idea of reporting. We are a state-run system, and I am the only policy administrative staff for APS for the entire state. This is falling to me. I haven't thought about it reporting, as I just got the initial spending plan and working on the state plan currently. Discussions about performance metrics and tracking performance is so very overwhelming to me at this point. And so we really appreciate that comment. And I think ACL is very sensitive to that perspective. We are in the process of rolling out additional technical assistance for the states, and I am hopeful that we will be able to facilitate ways that we can help states that are in your particular position, because we know that the administrative staffing in a lot of states is not there to support the work that comes with this particular type of funding. And so we do hope to provide the technical assistance to assist with that. Andy, anything you want to say about that?
No, just that it's coming. I say no and then I start talking. Yes, there will be more information coming about that. We actually have some of our subject matter experts that have recently been brought on to help with these things on this webinar today so that they can listen to what you're saying. So there is more help coming, but don't wait until you hear from us about the subject matter experts we'll be using. Contact us at any time to try and get help with that. That's why we're here.
And Nancy, I see your question. I think I'm going to hold it till the end, though. So let's go to the next session, which is partnerships. So the poll question is, do you have any partnerships to use for purchasing services? And when we're talking about partnerships here, we're not talking about a contract with this provider to come in and do home cleaning. They're our partner. I'm talking about, you know, it's not who you contract with, but is it somebody to help you in the partnership for your overall process of doing purchasing services? Who do you work with in the community to try to get providers? That kind of partnership to make the process work. So the question is, do you have any partnerships to use for purchasing services? Yes, no.
And I think we'll leave that open another 12 seconds or so. Give people a chance to vote. Maybe just about 5 more seconds. All right, I'm going to close that poll out and share the results. 42% said yes, 58% said no. So pretty close results there.
And so again, use the question box to describe these partnerships. We'd be interested to know what type of partnerships the states are using. And how about Mary? You want to go first. Describe some of your partnerships critical to successful purchase of services. And please send us your question.
I'm sorry, Carl, I missed, were you talking about internal or external partnerships?
Either one would be appropriate in this particular case.
Sure. Well, internally, we are highly dependent because we are a very small unit on our grants and contract specialists and our legal specialists for grants and contracts to both develop them as well as to guide on the monitoring required. We also work with our financial operations division to help with the financial monitoring and technical assistance. We have right now, thank goodness, an interagency agreement with Minnesota Analysis and Development, which is part of our Minnesota Management and Budget Agency, for consultation on this particular grant for planning and administration and monitoring of the grant. So we're highly dependent on partnerships for a lot of different reasons, silos of expertise, as well as just our own limitations. We've been working very, very closely with our Office of Indian Policy and our Indian Elders Coordinator on the Adult Protection Service grants that are going to our tribal nations. They have the relationship for government-to-government consultation with our Minnesota tribes to ensure that our tribal spending plans meet the ACL guidelines and provide services for people who meet Minnesota's definition of a vulnerable adult. So we've been working very closely with them. They are in contact with our tribal nations, and we're also going to be hiring a temporary consultant to provide technical assistance support in grants management administration, specifically for tribal governments that participate in this adult protection opportunity.
All right. Send any question Mary's way in the question box. And Victoria, partnerships.
Yeah, so with such a large program, we certainly here in Washington, we have a lot of moving parts at any given time. I think some of the partnerships that are kind of most important, especially as we get started up here, are just kind of our internal partnerships. So even though we're a state-run program, we do have a regional leadership structure, and we work very closely with our regions. Kathy Morgan, our director, oversees all of those 3 regions that I've kind of mentioned multiple times today. And so, you know, partnering with their management structure, partnering with our investigators directly and their supervisors, and kind of the entire up chain, because ultimately contracts and purchasing decisions are made at the regional level. Yes, our headquarters team, which I'm a part of, we do have ultimate oversight, and we are the ones who are reporting up, but you know, the decisions and the day-to-day decisions that are affecting our alleged victims are things that are happening at the regional level. And so those partnerships are really important to us. And then as far as external partnerships, again, all of our regions are responsible for identifying contracts for services and identifying places where they can purchase goods. And so they really rely on community partnerships and identifying vendors and individuals who are able to provide things for our alleged victims. So we got a lot of different partnerships, and we're currently actively looking for additional partnerships to support our work.
All right. I am not seeing any questions related to partnerships, and based on time, I am going to move us on to the last section. Oh, that was the last question. Last section. So any wrap up questions for our panelists, or any final thoughts that you might have? I did skip a question along the way that while we're getting final comments and questions, we might answer. And the question was, is there any criteria for eligibility to receive these purchased services? So I think the question is, what's the trigger? What's the eligibility requirement for a client that does versus a client that doesn't receive services?
This is Mary. Any client that is in our adult protection system, we're going on the Elder Justice Act definitions, as well as the technical assistance and guidance provided by ACL. Any client that's eligible for services in our adult protection system is eligible for these services. And then for the tribes, also using similar eligibility for maltreated vulnerable adults under our definitions.
Yeah, and this is Washington, and it's the same. We have definitions for what a vulnerable adult is, and then also, having that active investigation.
And Carl, this is Andy. If I could ask one quick question before we wrap up, that just occurred to me, and you may have addressed this and I missed it. I apologize. So, are any of these services time limited? Are they just offered throughout the duration of the investigation, or that the case is open, or even shorter periods of time?
This is Victoria. If I'm, oh, go for it, Mary. You can go for it.
Oh.
Oh, sorry, I should have prompted
Victoria.
one. Yeah, Victoria, why don't you go first?
Oh, sure. So we're just, if I'm understanding the question correctly, it was if we have a time limit on when we can provide services to our alleged victims. And so the way we've structured it so far is that if we have to have an investigation that our investigator is currently working. So,
Gotcha.
so it just has to be still in that gathering phase, gathering evidence and working with the alleged victim phase.
Great.
Mary?
And in Minnesota, adult protection can keep although the investigation has a 60-day time frame, the service portion doesn't have a 60-day time frame, so adult protection can work with that client longer than the investigative time period. So it would be during the time period that they're working with the person, although this federal grant has pretty strict criteria on how long, at least at this point, we can maintain it. And I also want to say that, partners, because they're in the water, it's like the air that we breathe, are our county partners who are actually going to be putting these grants out and getting
Sure.
the information and out to the clients. It's obvious, but needs to be said.
Thanks. Yeah, no, appreciate that.
We have another question. How do you connect the eligible APS client to COVID? And I guess that has to do with the requirements that the first round of the formula funding is related to COVID. Victoria, any thoughts on that?
So we discussed this with our project officer because we were concerned. So, I would probably recommend discussing directly with your project officer. But for us, we just ask that our investigators are gathering information, gathering knowledge about kind of what the need is and what the proposed solution is. I don't think we have like a hard and fast rule on this one.
Mary, anything?
We're also operating under the context of COVID and using the FAQs from ACL and our project officer to help us with that same answer.
Okay. Any other questions? we are bumping up against the hour, and so I think we are about done. If you have or think about any questions for our panelists, you can send them through us. And so you see our email address for the TA function here, which is APS Tarc. What do you call that thing? Something ta@acl.hhs.gov. You can find lots of other information and resources on our APS Tarc website, and you see the URL for that there. I want to thank Mary and Victoria most sincerely for doing the work to help prepare for this and sharing some of what their experience is in this particular area. And we really appreciate y'all participating in your insights today. And we also appreciate all of the great questions that y'all submitted. And please let us know if we can continue to support you in any way. Andy, any final thoughts?
I'll just say that there'll be a survey pop up at the end. If you could answer that for us, that'd be great. And this is recorded, so we'll let everybody know when it's been posted online. Thanks so much to everyone for attending. Have a great afternoon.
Thank you.